We're going to bring in Lexie Ranski and Victoria Drzyzga. They're students at Oakland University's School of Medicine. They're fourth year medical students, creators of Street Medicine Team. Thank you for being with us. We appreciate it.
Thank you for having us.
Good morning.
Okay, which one is Lexie? Which one's Victoria?
I'm Lexie.
And I'm Victoria or Tori.
Okay, thank you. I love what you guys are doing. How did you come up with this?
Well, so we're not the first ones to actually come up with the idea. It's actually a pretty old idea. It was originally started by a doctor in Pittsburgh. His name was Dr. Jim Withers, and he's still practicing street medicine. He developed street medicine, I think it was in 1996, actually. And then it kind of started as a movement from there. So we were initially introduced to it when we were in undergrad at Wayne State University, because they have a program. Their program's a bit older than ours. I think it's about 9 years old now. And when we were down at Wayne State in Detroit, we became very passionate about working with the homeless and the underserved. And we knew when we went to medical school, we wanted to start a program of our own. And being at Oakland University, you know, you're so close to Pontiac, which really doesn't have anything like this, a street medicine program. It's the first of its kind in Oakland County. So that's when we wanted to start this program.
So the two of you knew each other at Wayne State?
We did, yeah.
Yeah, we were friends and not really close friends actually for a while. And then our last year we became pretty close friends. And when we both found out that we were attending OU, we were like, oh, you know, we could do something pretty cool when we got there. So it was kind of fates that lined up a little bit.
Yeah, it worked out.
Lexie Ranski and Tori Drzyzga with us on the Oakland County MegaCast. They are from the Street Medicine Team and are students at the Oakland University William Beaumont School of Medicine. So when you are going out and you are treating people, you are helping people, how do you find these people that you are helping? Are they calling? Are you getting referrals to the street team? Are they coming to you? How's that working?
So we're not getting referrals yet. That's a future goal of ours. But right now, we're actually seeing patients in two different ways. So one way is on Friday nights, every other Friday, we're at Hope Adult Shelter, which is on Baldwin Avenue in Pontiac, seeing patients there, and they'll actually sign up to see us when we're at the shelter, just as you would in any other doctor's office. But on every other Saturday, we're actually going out on the street and directly caring for people who may not make it to the clinic or don't have a physician they see regularly. So we're finding people that way really by just walking around and just kind of seeing who we can find. We've been doing the actual street outreach since it was March. So we've kind of found where some people are living. We've gotten to know a lot of people. So we know where to find them now, and we're meeting new people every time we go out. So it's always an adventure. You never know what's going to happen.
And we meet the same people every week. So if we know if someone's staying somewhere specifically, we'll make sure to go visit them every single time we go out and build some continuity with them. Even if they don't have any medical issues, one time when we go out, maybe the next time they will, and they'll feel comfortable talking to us about them. So that's kind of the whole point. We visit the same people if we know where they're at and kind of build that relationship.
Mm-hmm. What's this been like to try to do this during a pandemic?
It's always a question we get. So honestly, COVID didn't change a ton for us in regards to what we're doing every week. I know a lot of the street medicine programs that are student-led, like we are, around the country did have to stop what they were doing. But Oakland University actually encouraged its students to continue serving the community as long as it was in a safe way. Mm-hmm. So we were fortunate enough to continue our efforts. And really the only thing that changed for us is we cut down on the volunteers that were coming out every week. Typically, we'll have about like 4 to 6 volunteers that are medical students come out every week so people can experience what street medicine is like and kind of get to know the community better. But for the past like 4 months or so.
Since like April.
Yeah, since April, we've had to cut it down. So it's just been our primary provider, which is one of our physicians from Beaumont, and then one or two of us from the leadership team. So that's a way that we've been kind of keeping it safe for ourselves and the people that we see. And it definitely became about a lot of counseling as well. Because a lot of people we met out on the street or even at the shelter, they were happy to see a physician, someone who's in the thick of it, who really knows what's going on, and kind of talk to them about what COVID really is and how is it really spread and how can we protect ourselves. So it became about a lot of education during that time as well.
Yeah, and we felt it was important to continue going out during the pandemic, because just because there's a pandemic going on doesn't mean that people's health conditions disappear. You know, they still have their diabetes that needs to be managed. They still have their high blood pressure that needs some medication or a check every now and then. So we thought it was really important to continue our work, and we think our patients really appreciated that as well. And now we're actually starting to integrate students back into our outreach events. We actually have one tonight at Hope Shelter. So we have about 6 students going and a couple of us from our leadership team. So slowly but surely integrating students back with, you know, of course, PPE, masks, gloves, hand sanitizer, goggles if people feel the need, and things like that.
Lexie Ranski and Victoria Drzyzga with us on the Oakland County MegaCast. They are both students at the Oakland University William Beaumont School of Medicine and are the leaders of the street medicine team as well, a team that has it's bringing over 55 Oakland University William Beaumont School of Medicine students to shelters and social service centers to treat acute medical problems wherever those patients may be. And recently the team received a significant amount of grant money from a local foundation. Could you tell us about that process, who you got the funds from, and where those funds will be put to use?
Yeah, so absolutely. In addition to, I'll touch on that in a second, but our initial funding came from Blue Cross Blue Shield. That's how we actually got the program started about a year ago now. So we're really thankful for that initial funding that got us going. And now, a year into our program, we were fortunate enough to get this most recent grant from the DMC Foundation. And the way we got that, we're very fortunate because at our school, we have a professor who's really been helping us out on the administrative side, who actually does a lot of work, or has done a lot of work in the past with the homeless. He's written books about it, documentaries. Really all of his work kind of revolves around that. So he's been really passionate about this work as well. So he's the one that actually reached out and was able to get this grant for us. So we're very thankful to him, Dr. Jason Wasserman. And kind of moving forward with this grant, of course, some of it is going to go towards our our usual things that we need to have funds for, medications, different medical supplies. Other things that we hope to do is kind of improve like the preventative care that we're doing. So try to get some lab testing involved, so we can be checking people's like HbA1cs for their diabetes, for their cholesterol, or other things like that. That's something that we would like to start integrating. We'd also like to try to do some more like advertising in the community. So hopefully when COVID kind of slows down a bit, we want to have like a sort of like a health fair where we can introduce ourselves again to the community. We can introduce our partners like Gary Bernstein Community Health Clinic, who we work very closely with, the Oakland County Health Division. We have a lot of people that we kind of want to get out there in the community and introduce themselves again, and kind of show that we're working together. So that's something we want to use the money for as well.
We're also looking into getting telehealth backpacks.
Yes.
So that's a really cool thing that's some of this grant money is going towards. We hope to use it a lot for mental health services. A lot of our patients that we see have mental health histories, and they have trouble getting in to see psychiatrists or mental health professionals. So we're hoping that the telehealth backpacks will help us communicate with mental health providers while we're at the shelter or while we're on the street, and they don't have to be there physically. So in this time of that telehealth is kind of like skyrocketed, we're hoping to kind of get in to that avenue of medicine and see if it can help our patients. And when we're not using it as a street medicine program, Gary Bernstein Community Health Clinic will be able to utilize that as well to kind of do telehealth visits with specialists if their patients need a specialist. So that's something really exciting that this grant is going towards too. Yes. So yeah, we're really thankful that we were able to secure this grant money and continue improving our program.
It is a great program and a much needed program. The both of you are fourth year students. What do you think this experience is going to, or how do you think this experience is going to help you as you move into your residency?
Well, so I would say, I mean, definitely over the past 4 years, working to build this program and working within it has really grown my passion, at least for working with the homeless population and street medicine itself. So I definitely want to incorporate it into my career down the line. We're both going into family medicine. So my goal is to have a clinic, outpatient clinic, and then be on the street at least 1 day a week, because I think this work's really important.
Yeah, and I just think that it helped us a lot with like organizational skills, just like kind of basic things that you really needed as a physician. We were able to kind of get out into the community, find community partners. And I think that's super important as a family medicine physician as well. You need to know what resources are already available to your patients where you're at and not reinvent the wheel on some things that are already present. So that was kind of a good thing for me to learn. And I think for us to learn as well. And like Lexie, I think that my passion for working with underserved has just gotten bigger, and we hope to go to residency programs that kind of support this work and allow us to do this work while we're in residency. And I think it was really important for us to know how to work with this particular population that often lacks a lot of trust in healthcare systems. So hopefully we can kind of break down some barriers that they face by going to them where they're at.
Absolutely.
As I mentioned earlier, I actually did a homeless retreat on the streets of Detroit I think we were out there for 4 or 5 days, and it's such a wide opening experience, but it was also emotionally draining. Have there been days for the both of you that you were out there on the streets trying to treat people that emotionally you were just like, I can't do this any longer?
I think that it does become, it can become frustrating. And I think it's more because of our healthcare system than anything. Because one thing that we've really learned a lot about doing this work is just the crazy amount of barriers that these people face to getting quality healthcare. And I think that's what becomes so frustrating, because even if you meet patients who, want to be following up with a physician regularly, or want to be taking their medications correctly, or want to be in physical therapy, or, they could want to do all these things, but if you lack the insurance or you lack the transportation or any of these number of barriers these people face, it's just not possible for them. And so that, I would say, is the most frustrating thing, I think, for us, because you could be there doing the work, your patient could want to be putting the work in, but if they don't have the means to get there, that's very challenging.
Yeah, I would agree. I don't think I've had that, emotional thing where I'm like, I can't do this anymore, but definitely felt frustrations in those regards. And I think the frustrations kind of fuel us a little bit, actually. So even if we feel these frustrations, it's kind of like we try to make them to fuel us a little bit. We try to do whatever we can to get our patients where they want to be, and make their healthcare goals attainable. So even if it's a little bit frustrating, even if it's a little bit emotionally draining, we still think it's really important work. And I think it kind of helps us and lights a fire under us to get some things done.
So for those that are hearing your story and the work that you're doing for the first time, where can they find out more information, or even if they want to donate?
Well, we don't have an avenue to be accepting donations right now. And really, I think just recently we've been getting the word out about our program. We've been really fortunate to have people like you pick up our story and, have interest in what we're doing. We do have, we have a Facebook page that people could follow along with. That's where we post our updates and articles and kind of share what we're doing. on a week-to-week basis. So that Facebook page is Street Medicine Pontiac at OUWB. So if people want to follow that, that would be amazing. We love to have more support.
Thank you guys so much for being on the show. It gives us so much hope for our future. You know, we're all a little stressed out, and I will say I'm a little bit older, and sometimes we're like, you millennials, but meeting the two of you, it really is inspiring, and you are making a big difference. So thank you for what you're doing. I know it's not easy, and good luck to the both of you. And we'll definitely try to post your Facebook page and share it a few times and get you some followers. And good luck with the rest of your college career, and then it's on to residency, right?
Mm-hmm. Yep.
Sleep now.
Everyone.
Well, thank you both. We definitely appreciate having you on the Oakland County MegaCast.
Thank you.